Hi, this is Greg Johnson with Blue Book Services. I'm here today with Dr. Taylor Wallace, who's a professor at George Mason University. He's also the CEO and founder of the Think Healthy Group, and he's been involved as lead author of a new research project that came out that the Produce for Better Health Foundation has popularized in the produce industry. And Taylor, if you could just explain to our audience kind of what this research found out. Obviously we know fruits and vegetables are healthy, but what kind of new angle did we find in this research that might be able to be useful to the industry?
Right. So we've always known that fruits and vegetables are healthy. From a policy perspective, fruits and vegetables have really maintained their position because they're generally low in calories and very high in their nutrient contents. Our study was an umbrella review where we basically searched through the entire body of scientific literature. And what we found is that, yes, while fruits and vegetables are low in energy density, and they do have a very unique nutrient package, they also have bioactive compounds and benefits beyond providing basic nutritional requirements for humans. So some of the things we found are really strong responses in regard to cardiovascular disease, certain types of cancer, even osteoporosis with higher fruit and vegetable intakes over the lifespan. So this really calls for the argument that we not only need to be promoting fruits and vegetables to meet essential nutrient requirements, but we need to up our fruits and vegetables every day for long-term health promotion and disease prevention.
So getting along the preventative aspect as opposed to just being part of a diet.
Absolutely.
Well, what are some things you think can help fruits and vegetables get more into a public policy situation? Is there a way to help convince the government to help more and promote consumption of fruits and vegetables?
Well, I hope this paper does just that. I mean, if you look at cardiovascular disease, it's the number one killer among Americans. There are so many obesity and nutrition related chronic diseases, and this really stems from suboptimal diet throughout our lifespan. And so, one of the things I feel like government should really be emphasizing is upping the messages, particularly towards children, through the National School Lunch Program and breakfast programs, getting those 5 servings of fruits and vegetables per day early on, establishing those good, healthy habits early on. I think you'll be able to see us potentially mitigate diseases like cardiovascular disease to a certain extent just by instilling those healthy habits in children early on. So I think government has a lot to do in this area.
How optimistic are you that we can improve on that process and involvement of fruits and vegetables?
Well, look, I'm very optimistic. The former First Lady Michelle Obama had a great campaign. There's definitely metrics centered around that shows success in children. Right now, the obesity epidemic in children is still increasing, but I think there have been success stories. You see this all over the place in different parts of the country. And so again, going back to children, I think instilling those good habits early on can really lead to a lifetime of benefit.
What would you say some things that the produce industry could do to take this health message and put it in different terms to consumers about how important fruits and vegetables are to a daily diet?
Well, I think there's several things that the produce industry can do. If you remember when I was a kid, they introduced the baby carrots, and that really just made it easy for us to consume carrots every day. I think package innovations are a big thing, making fruits and vegetables more appealing to kids through packaging and portion sizes and control. I think that's a big issue. I think that offering fruits and vegetables in various forms, because we know that a lot of people suffer in food deserts and have issues with access to fresh produce, especially in the winter months, and different biotechnology that can enable us to get fresh produce or produce that is in a different form, but still maintaining the health attributes of the original fruit or vegetable. I think it's going to be really important in moving forward and promoting the health of our nation.
Yeah, I agree. I hope so too. I'm optimistic, and we'll see where we can get with this this government and all the marketing. Thanks a lot for joining us today. We appreciate working with you and your work with PBH, and look forward to seeing more things that can come out of your research.
Thanks so much. Really appreciate it. And it's been a phenomenal experience to work with the PBH Foundation. They are an incredible foundation. And
All right, I agree. Thanks, Taylor.